Good evening, class. This is the Management Information Services class at Florida State College of Jacksonville. This is Group F's. We had selected for us St. Vincent's Medical Center. Anyone familiar with the area is familiar with St. Vincent's. St. Vincent's was founded in 1916 by the Daughters of Charity. They took over the DeSoto Sanitarium downtown in the old Springfield section of Jacksonville. In 1939, they became part of and were recognized by the American Hospital Association, and they received the Top 50 award by the U.S. News and World Report for hospitals in the United States in 2003, 2005, and 2006. So they have a long, humble beginning, but they have distinguished themselves over the years as a leader in the medical services. Patient care is their primary mission. They do not discriminate. They are a faith-based and nonprofit organization. In 1999, they combined with the Ascension Health Systems, which is directed by the church to provide health care for the needy across the United States. They currently have over 70 facilities in the United States. The leaders of the St. Vincent's Medical Center are community and religious leaders. It is nonprofit, they are business people, but first and foremost, it is a community service. They are here to serve the medical needs of any and all who may need them. They offer extensive career training in medical technology, which includes robotic surgery, any new medical technology that has come about over the last almost near century that they've been in business, and any new advances that are coming along. They don't just sit back and use what's already been developed. They are testing new technology, new techniques to further their ability to serve the public. They offer radiology technology, which is x-rays. That is not just simply taking an x-ray, making a film of it, and looking at a piece of film. There's also a lot of technology involved in that now. It's like where it is analyzed by a computer system, and there's also a lot of training involved for the medical technicians, not only to interpret it, but also to explain that and show the patients, how the information that they're getting is used, how it is used, what the patient can use it for, and explain what they are seeing. There's a lot of diagnostic tools and technology that St. Vincent's trains their medical personnel in. There's a lot of computer technology nowadays. Instead of just looking at a patient, trying to determine what's wrong like they used to in the old days with a fever, blood pressure, there's a lot of computer analysis, a lot of raw data that's taken, from a patient, from the blood pressure, from the blood. It's analyzed. There's all sorts of information they can get, from there. They need to analyze all that, for proper diagnostic tools to identify exactly what is wrong with the patient and what's the best course of treatment. There's a lot of new radiation and nuclear technology being developed and used to work with a lot of different illnesses, primarily cancer, as you can imagine. That's two of the main illnesses that radiation and nuclear would treat, is to take care of cancer, tumors, and throughout the human. As you can imagine, St. Vincent's Medical Center requires a large technology base to support all of their electronic records and all of their diagnostic and electronic tools. They have multiple servers across their network, which is used for many different reasons. They have an eClinics Works program that allows them to give access to all information, billing, medical records for patients, and gives access to multiple medical disciplines across a wide spectrum. This allows for a small clinic in a small rural city to have access to specialists that would be out of reach for a lot of people because it's too far, or just give a lot of people from across the country the chance to collaborate on a patient's case. They use electronic medical records, which allows everybody access to a patient's records, input, and keep track of all medical data so it's not lost, Anytime you go to another doctor, the electronic medical records are available, so everything that has ever been done, any allergies, any medical procedures, all the data is in there available for any medical person to use to help better keep track of care. They offer a lot of e-billing and e-commerce tools. E-billing allows patients to go on and pay for their bills or medical procedures online, same as we would going through many other organizations. E-commerce, just like anyone else, I mean, they do offer services that for florists and gift shops that allows people to, across the internet, go in and order flowers or a gift for someone, or a loved one, or a friend, someone they know that's in a hospital. As one can imagine, technology has greatly improved the care and the identification of many illnesses and treatments for patient care. Right now, St. Vincent's is in a pilot program with Duke Medical Center for brain cancer, one of the most common and deadly types of brain cancer. There is a trial drug right now, which is a vaccine, which will help these brain cancer patients live. It's very the mortality rate for this disease is extremely high, and this is a new program. St. Vincent's is part of it. This allows people in this part of the country, for example, this will be based out of Jacksonville. This allows people in this part of the country to have access to this trial program, those who might not have access to it otherwise.